My name is Leah, and today I'm going to be presenting oral irrigators versus traditional dental floss. I picked this because I never really understood why people used oral irrigators, and I never even understood the main concept of them. I think this is mainly because I never even had braces, and growing up I just used a manual toothbrush, and I still to this day don't even have an electric toothbrush, so I'm really slacking on that. But anyways, while looking and researching oral irrigators, I thought, how cool would it be to talk about oral irrigators versus traditional dental floss, and if there's even a significance of difference between both of them. So there's no single cleaning aid that works best for all patients. This is due to the patient's anatomy in the inner dental space, the patient's acceptability, their personal dexterity, and the person's motivation. And I wanted to add that as our patient population is getting older, and if they're older, they're most likely to have other health conditions like patient dexterity. I feel there's still ways we can maintain oral health, and that's kind of where the water pick comes into play. And I'm going to go a little deeper on that, but there's so many mechanisms on the market that we can all get flossing done in a variety of ways, but there is no perfect delivery method that works best for everyone. And while we're working in healthcare, kind of knowing like floss or a water irrigator, which one would be best for the type of patient, could be beneficial in the future. So why is this significant? Why do we have to floss in general? So I kind of began my research paper with some facts, like brushing alone twice daily is not as effective in removing bacteria, plaque, and the accumulation of buildup in their inner dental spaces. So when we have inner dental spaces left with biofilm to accumulate, we increase our risk of dental caries, periodontal disease, and gingival inflammation. So in order to control that plaque buildup, routine quality flossing needs to be a part of a patient's daily hygiene practice. And I want to say this again, as this is difficult to achieve, a variety of devices can be picked from to make the patient's flossing job more enjoyable. And like I said previously, as technology is improving and public health evolves, new and improved dental devices are produced and encouraged to the public. And that's a point I really emphasize in my research paper. So, oral irrigators versus traditional dental floss, what I kind of found. With oral irrigators, like I mentioned, as our population has more elders, we have further health conditions. An oral irrigator or a water pick can be a little more flexible with patients' dexterity. Say they can't grab a toothbrush, or they can't take floss in between their teeth because maybe they're missing a finger or they're missing an arm. A water irrigator you can just use with one hand, kind of even far away, very relaxed. A con to the oral irrigators, you have to be using it at home, whereas traditional dental floss you can use anywhere. Also, patients with fixed appliances like implants, water picks are proven to be very beneficial for those with implants. People with a lingual bar, you can't floss, so a water flosser is great for in those spaces there. You can also fill that holding tank, which I have a picture in a second, with chlorhexidine. I've heard of people putting mouthwash in their water tank. Also, the oral irrigator is very gentle on the oral mucosa. So if you do have someone that has an implant and it's a little infected and flossing just irritates the gums, we can kind of massage the gums with pulsating water coming from the water pick. Some pros to traditional dental floss: you can use it anywhere. You can use it when you're driving your car. You know the drill with that. There's also a variety of types. There's different materials like nylon, or you can have waxed dental floss, and there's a variety of flavors. You can have mint or cinnamon. So here's our floss. We all know that delivery method. We use it all the time, every day in the dental office. And then we have our oral irrigator, also known as our water pick. Professional research calls them oral irrigators, so now I'm kind of have a habit of saying that. But you can see the holding tank, like I mentioned before, and a variety of tips used with the oral irrigator. So I got a lot of my information from this study. It was the effect of subgingival oral irrigation as an adjunct to toothbrushing on plaque accumulation in chronic generalized gingivitis patients. So there's 70 patients. They all had severe gingivitis on more than 20 teeth. They were put into 5 groups, and each group was a little different. For example, group 1 only had a toothbrush, brushed for 2 minutes twice a day. And then group 5, say they had an electric toothbrush and used the water pick and used chlorhexidine. So on this study was taken, they took data on the first day, the 14th day, and the 28th day. So it was a 3-week long study of these patients being dedicated to following the instructions provided for the study. So what they found is chlorhexidine solution is really beneficial, and it's even better than using plain water. So I think that's really fascinating. I know that's not really comparing floss and oral irrigating, but still I had really good results using chlorhexidine in the holding tank of the water pick. So the water flosser compared to string floss provides that a water flosser does have optimal results, and that is what that study found. So along with a reduction in bleeding and gingivitis, patients with fixed appliances had better results with the use of a water flosser compared to those groups using traditional dental floss. Jacqueline Fried said that. She was another resource I had. And here are my references. Thank you.